welcome, and Tuba, welcome
Thank
to
you.
Morning News today. It's a big day for you guys, I guess, today with the launch of this app, Doctor. Has it been in the works for quite some time now? Because I understand there has been a pilot already.
Correct. Well, we've been working on the Kidz Alive program for around 10 years already. And the app is around 18 months old in the making. We were very excited to think about how can we take this to more people, how can we scale its reach. So 18 months ago we came up with a concept, and we've been working together with Qualcomm to make it come alive.
Yeah.
So we're really excited.
And today you're launching it.
We are
at
launching
here
it
in
today.
Johannesburg. How has the pilot been overall?
The pilot has completely astounded us. We kind of knew we had a suspicion that it was going to be helpful. But once we started getting the results from the healthcare workers, we were really shocked. Healthcare workers had a 62% increase in confidence to work with children. The children themselves were excited about being tested for HIV. They kind of took the whole fear out of the process for them. The caregivers are excited. So we were quite blown away, actually.
Before I speak to Tuba, why the focus on children is because there's been a sense that they've been marginalized in the fight against HIV/AIDS?
Correct. Many children are living with HIV, but perhaps their parents have died. Nobody knew the parent died of HIV, and so now they're living kind of a normal kind of a life, and no one suspects that they actually have HIV. So we have probably 500,000 children in the country living with HIV that don't know that they're infected.
And hopefully through this app and your
Correct.
campaign, there'll be more awareness and really what's the right way to deal with it.
Correct.
Yeah, Tuba, you're an HIV activist, and welcome, as I said earlier. How do you welcome the news of this app?
I-app le asikhuluma ngayo Kidz Alive app ingijabulisa kakhulu because kunezinto eziningi esifunda kuyona, and the time mina ngizalwa ne-HIV ngabo 96 akho app yayikhona, akho umuntu even engangikhona ukukhuluma naye, but ukuthola izinto enjengalezi ukuthi i-technology yakhona ukuthi isize even abantu abasha nabancane ekutheni bafunde more about HIV, kuyangijabulisa kakhulu mina.
Okay, so when you were born with it,
Yes.
and you didn't get the support that you required,
Yes.
and you believe the app will be successful, and I understand you do motivational talks as well, and what's your message?
Uyazi indaba ye-amp ingijabulisa kakhulu because emaklinikhi bayakhona ukuthi basizakala abantu, iyakhona ukusebenzisana namakhansela asebenza khona. Uyakhona ukuthi uma uthesta ingane uthole izinto eziningi ezenzakalayo kuyona, agcina ukuthi siyiluleke siyifundise nge-HIV, but kukhona izinto sibone ukuthi ekhaya mhlawumbe ngabe iyahlukumezeka yini ingane, iphetheke kanjani, akekho umuntu oyi-abusayo. So i-app leyo ifundisa izinto eziningi iyodwa, ifundisa HIV, iphinde ifundise ngokuphatheka kwengane ukuthi iphatheke kanjani, ufunde nanengqondo yengane ukuthi ikanjani.
Yeah, and I guess because many of us young people as well and old people nowadays use mobiles, and we are all on our phones doing one thing or another.
Yeah.
This is a perfect solution,
Yes.
especially for young people, Doc.
It's amazing because, especially children, they're intuitive. They know what to do with this thing that's in front of them. So the app is a tablet base, and so the children are really able to interact with the games and with the stories. And they, I think for the first time, feel like they are part of their own healthcare solution.
Yeah, who's going to be at the launch today? We're going to have young people like Tuba there and them, and children
Correct.
who've already been in the pilot, and we're going to have some thought leaders there as well, people who can help to take it forward.
Correct. So we have thought leaders, we have corporates who may be interested in investing, we have children who have been part of the journey, our donors, Qualcomm and KCA, Keep a Child Alive. And then people who are really interested in children, who have the kind of
Tuba,
heart
we
of
heard
children.
the doc saying that about 500,000 children or young people in South Africa today who may be living with HIV,
Yes.
HIV or HIV positive rather,
Correct.
who may not be aware of it. And you were born with it, you said
Yeah.
way back in, you said 1996.
96.
And now you've been motivating people, and look at you, you know, and I love your hairstyle. It's great and stuff.
Thank you so much.
I mean, what is a message that you want young people to hear, those who may be afraid, because there's still some stigma surrounding HIV/AIDS in our country, sadly so.
Yeah, we about the time I found out about ukuthi ngizalwe ne-HIV ngaba ne-anger for umzali, ngaba ne-anger even for uNkulunkulu qobo lwakhe, even umndeni. But when times goes on, I understand, I have to ukuthi ngi-attend ama-training abakhona. The times ngi-understand ngagula ngacishe ngashona 2013. Ila khona engamuva to the second regimen, or regimen 2, because we only have 2 regimen kuma-ARVs. So the time ngiba khona kona, I learn izinto eziningi lokuthi inkosi izenza izinto ngenhloso. Ukuba khona kwami kulamaphilisi esibili, I think kumele kube khona umyalezo ngodlulisayo. Khumbula inkosi uNkosi Johnson ukuthi washeshe washona engakuqedi ijini yakhe ayefisa ukuyihamba. I feel like I have to take over la khona uNkosi Johnson ahluleka khona ngifundisa abantu abasha ngiphinde futhi ngiphile example. iHIV ayona inkinga ila ukhona wena ungasayithathi kahle medication yakho khona.
Treatment is very important.
Yes ukuthi uyithathe ngendlela uattend zonke izinto kuthiwa clinics attend ula isebenzisane nodokotela.
Yeah. Now you are a group. Sorry, Doc. You are Zoe Life. That's an NGO. Qualcomm Wireless Reach is a private entity. You've mentioned corporates. Government supportive of this in your interaction? Are they going to be part of this?
Government is extremely important because this app was developed for government. It was absolutely developed for healthcare workers. We've piloted in the clinics. District provinces are incredibly supportive of the work, so we're very grateful to them that they've been so open. And yeah.
Well, good luck. I mean, this launch is at the Turban Hall today in Newtown in Johannesburg, and I'm sure we're going to hear more about it going forward. Hopefully, you can get more support. And Tuba, you need to keep on spreading the message. I don't know what your plans are going forward.
Maningi ama-plan so into engifisa ukuthi yenzeke ngifisa ukuthi kugwemeke ukuzaleka kwengane ne-HIV. Akhona amaphilisi okutheni uvukele ingane uma umzali ekutheni ingatheleleki ukuthi uqale iclinic ngesikhathi and make sure ukuthi isikhona ke ingane manje sizalwe ne-HIV hambe eclinic attenda make sure ukuthi ingane iyafunda ngo-Kidz Alive iyafunda ngoThukthuli ukuthi kwenzakalani. I-team yanamhlanje sithi #living the life to the fullest and #Kidz Alive and then #the future bright the future. So please sicela ukuthi abantu banakekele impilo zabo sicela ukuthi abantu basemisane nemindeni ukuthi bakhona ukuphila kahle.
Thank you very much. And Doc, thank you very much. And good luck with the launch and good luck with the future. Dr. Stephanie Thomas there and HIV activist Tuba Shazi.